to defund it going forward.
Joining me now, Congressman Dennis Kucinich, Democrat of Ohio, and Congressman Phil Rowe, Republican of Tennessee, who is also a medical doctor. Congressman Kucinich, how would you assess the tone as Congress gets back to work?
Somber. Members are certainly mindful that one of our colleagues is struggling for her life in a Tucson hospital. They're aware that staffers were injured and one staffer lost his life, that other innocent people were killed in Tucson. And, you know, members of Congress get to Congress because they have a connection with people. This is a national tragedy. We're going back to work still feeling that. And I think it's having an effect. I see members of Congress, Democrat and Republican, making an effort to go across the aisle and talk with each other, because there really is a feeling that we need to, we may close ranks on an issue, but we understand that we need to try to proceed in a way that is civil. And
Congressman Kucinich, are you joining the move for Democrats and Republicans to sit together at the State of the Union address?
Oh, I think that's a great idea, and I certainly will have no problem doing that. I work both sides of the aisle. I've been doing that ever since I've been in Congress. I think it's important for us to recognize that there are issues that are much bigger than whether you're a Democrat or Republican. There's something about a core of what it means to be an American, and how we really need to recognize the essential unity that binds us as Americans, and especially at this time of grief.
Congressman Phil Rowe, you are a physician, just like Bill Frist, who was the Republican leader of the United States Senate. I want you to listen to what Bill Frist said today about repealing health care reform.
Is not the bill that they would have written. It's not the bill that I would have drafted, but it is the law of the land, and it is the platform, the fundamental platform upon which all future efforts to make this system better for that patient, for that family, for that community will be based. And that's a fact. It has many strong elements, and those elements, whatever happens, need to be preserved, need to be cuddled, need to be snuggled, need to be promoted, and need to be implemented.
Dr. Rowe, how do you respond to that second opinion from Dr. Frist?
Well, I certainly know Dr. Frist well and have great respect for him. I just respectfully disagree. I think that we have had an experience in the state of Tennessee with managed care health, and it has been, to say the least, a failure. Lawrence, we talked a couple of weeks ago when I was on the show about why I came to Congress, and I agree with what Representative Kucinich just said about the mood in the Congress right now. But when I came here, I came about as partisan as you could come. I've never seen a Republican or a Democrat heart attack. I've never seen a Republican, never operated on a Republican or Democrat cancer. These are just people problems. We have legitimate disagreements about how we solve these problems. And certainly if we have time on the show today, I'd like to go into those in Tennessee and why I'd like to see us repeal this and have a better bill. It's not repeal, and that's the only thing. We have a lot of great ideas about replacement. Let me give you one of my frustrations. There were about 10 of us, 12 of us in our doctor's caucus, and not any of us were consulted on this bill that was passed. That was very frustrating to me, to bring 30 years of experience in health care and never be asked. We had 80 amendments. One of my amendments I'm going to submit next week is a bill, the repeal of IPAB, and we can talk about that later, wasn't even voted on. We couldn't even get a vote on the House floor on 80 amendments, and that was very, very frustrating for me.
Congressman Kucinich, the Republicans made a great deal of the polling fact that kept coming up during last year's debate, that a majority, slightly over 50%, were opposed to the Democratic bill, the Obama bill, however it was described, although there was much higher support for individual components of it, like the public option. The overall bill was treated as with a slight majority in most polls of opposition to it. Now, only 26% in an AP poll, only 26% want repeal. And so we see now the Republicans mounting an effort that is counter to what polls are saying. Do you hear Republicans citing polls now that they're operating legislatively in opposition to what the polls support?
Well, first of all, I want to say that I trust the integrity of my good friend, Congressman Rowe, Dr. Rowe. We have a difference of opinion. The polls that have come out would indicate that the public's starting to focus even more strongly on what the repeal of the health care legislation would mean. I mean, there was a report out today that said 129 million Americans have pre-existing conditions. So if you repeal the pre-existing conditions and don't require insurance companies to cover people with pre-existing conditions, it's going to affect about, almost a third, more than a third of the country. In addition to that, you have to keep in mind that there are 50 million Americans without any health insurance at all. I mean, that's a number that we ought to pay attention to. We don't have to take a poll about that. That is a fact. Read the Kaiser Foundation's recent report in that regard.
Congressman Rowe, are Republicans worried about taking a legislative action and taking a vote in the House of Representatives that is opposed by, in the poll we just saw, it's opposed by 62% of the public?
Well, I would argue, Dennis, that we had a poll on Dennis and Lawrence, that we had a poll the 2nd of November, which was an overwhelming rejection. Not anybody that I know, including the Democrats who ran on the Obamacare plan. People ran to overturn this. And just to correct a couple of things that came out with this 129 million, remember that 61% of the people in this country get their health insurance through a private employer. It's against the law right now to discriminate for pre-existing conditions. That law is called HIPAA. You can't do that now. The other part is that if you currently have Medicaid or Medicare, that also prohibits the pre-existing condition. And it is a problem. There's no question. Listen, I'm not here to support insurance companies. I've gone to battle with them over the last 30 years about providing care for my patients. But let's be clear about this pre-existing condition issue.
Congressman Kucinich, it is hopeless for this Republican crusade to repeal Obamacare, as they call it now, because the Senate, even though the House will probably pass it, the Senate will not take it up. There will not be a vote. We obviously have a Democratic president who would veto anything that came to him in that way. But with announcements that are coming out of the Senate now of Kent Conrad not running for re-election, Joe Lieberman not running for re-election, the Democratic hold on the Senate looks increasingly shaky. It looks like the Republicans will have the momentum now going into the 2012 election to take the Senate, no matter who wins the White House. And so some of this activity that you're going to see in the Republican House this year may be a dress rehearsal for what we see in the next Congress, possibly controlling both the House and the Senate with Republicans. So are Democrats taking this Republican legislative activity much more seriously now that it looks like the grip on the Senate may be loosening in the next election?
Well, let's face it, American people voted for the Republicans to be in power. That's what Congressman Rowe is referring to. That ought to be taken seriously, but it also ought to be challenged in a two-party system. I think one of the things that's going to come out as a result of this effort to repeal the health care bill is that it will bring a renewed discussion of universal single-payer, not-for-profit health care, Medicare for all, because that's real reform. That's reform which says we don't want for-profit medicine, we want not-for-profit health care. And the reform that we have now is only within the context of a for-profit system. We're in a way, we're debating around the edges of a much deeper central question, and that is, why should we have to go to insurance companies to determine whether people are going to have health care or not? Insurance companies make money not providing health care.
Congressman Kucinich, that is the beginning of a great debate that I would like you and Congressman Rowe to have on this show at another time. Out of time for tonight, Congressman Phil Rowe, Republican of Tennessee, and Congressman Dennis Kucinich, Democrat of Ohio, thank you both for your time and your tone tonight. Thank you both.
Thank you.